tie has become a catch-all label for almost any early feeding challenge. Having a visible tissue fold under the tongue is not the same as having a functional tongue tie. If you've ever experienced excruciating pain while breastfeeding, or if your baby makes a clicking sound every time they suck, chances are someone in that parenting group or family circle has whispered the words, "Have you checked for a tongue tie?" Hi everyone, welcome to Lit Actions. I am Dr. Odi. We believe that big changes in our child's health don't happen overnight. They happen when we stack our little actions every single day. On this channel, we break down parenting into simple, manageable steps so you can feel confident about the choices you're making for your family. In honor of World Breastfeeding Week, today we're talking all about tongue tie and breastfeeding. Tongue tie has become one of the most talked about topics in newborn care today. And while a true tongue tie can cause real feeding distress, there's a massive conversation happening right now about whether we are overdiagnosing tongue tie or missing simple positioning adjustments that could fix the problem without a surgical procedure. In this video, we are unpacking what tongue tie actually is, how common it really is, how to tell if there's a functional restriction or a technique issue, and the exact steps you should take. If you want clear, evidence-based guidance to make your parenting journey smoother, hit that subscribe button and let's jump into the topic. Now we'll be looking at section 1. How common is it really? How common is tongue tie? First, let's get grounded in the facts. Anatomically, everyone has a lingual frenulum, that small band of tissue connecting the underside of the tongue to the floor of the mouth. The medical name for tongue tie is ankyloglossia. Tongue tie happens when that band is unusually short, thick, or tight, thereby restricting the tongue's mobility. Studies show that true tongue tie affects between 3% and 11% of newborns. But here is what's fascinating. Up to 75% of these infants with tongue tie show no symptom at all and zero feeding issues. Yet, in the last decades, surgical releases for tongue tie have increased by several 100% in several parts of the world. Why the sudden jump? Part of it is better awareness, which is great. But part of it is that tongue tie has become a catch-all label for almost any early feeding challenge. Here's the key distinction every parent needs to know. Having a visible tissue fold under the tongue is not the same as having a functional tongue tie. A tongue tie is only a clinical problem if it restricts the tongue from doing its job during feeding. As I mentioned, most infants with a tongue tie won't actually have feeding issues. Now let's move to section 2. Let's look at tongue tie versus paw technique. So, is it a tongue tie or a paw technique? This is where things get really tricky because a shallow latch can cause 90% of the exact same symptom as tongue tie. Be sure to check out our video on latching where I go into details on how to get a deep latch. Check that in the description. Now think about how a baby feeds. A baby doesn't just bite down on the nipple. They use their tongue in a wave-like motion to cup the breast, bringing tissue deep into the back of their mouth and massaging milk out. If a baby has a shallow latch, meaning they are resting just on the tip of the nipple, you will likely experience severe nipple pain, flattened or lipstick-shaped nipples after a feed, clicking sounds, air swallowing, and a baby who gets frustrated or slips off constantly. Those are the exact same symptoms people associate with tongue tie. In a vast number of cases, adjusting the feeding techniques, like bringing baby deeper onto the breast, changing the angle of head extension, or trying a laid-back positioning, instantly resolves the pain and restores milk transfer without any medical intervention. Poor positioning and a shallow latch mimic tongue tie, which is why optimizing technique is always step number one. A quick pause now. If this is giving you a bit of clarity or taking some pressure off your shoulders, take 2 seconds to hit that subscribe button. Early feeding challenges can feel so overwhelming, but every week we share clear, evidence-based guides to make these early months simpler and far less stressful for you. Subscribing helps us reach other parents who might be awake struggling through a painful 2 a.m. feed right now. Now let's look at the exact signs of a true functional tongue tie. A functional tongue tie means that the band under the tongue directly interferes with tongue movement, which can result in feeding issues or later speech problems. So how do you know if it might actually be a true functional tongue tie? We look for specific physical limitations alongside physical difficulties. Now let's look at the signs. On the baby's side, limited mobility. When baby cries or gapes, their tongue doesn't lift to the roof of their mouth or extend past their lower lip. Now, a heart-shaped tongue. The tip of the tongue can look notched or pulled back into a heart shape when they try to extend their tongue. Inability to cup. The tongue stays flat or cupped upwards instead of wrapping around your finger or the breast. Constant sleeping. Baby continuously loses suction and breaks the seal despite optimal positioning. On the parent's side, there may be persistent severe nipple damage or distortion even after a lactation specialist has hands-on adjusted your latch. There may also be recurrent clogged ducts or mastitis due to incomplete milk drainage. If positioning is optimized and baby still physically cannot lift or extend their tongue to transfer milk, then we can consider a functional restriction. Section 4. What to do? Your 3-step action plan. If you suspect a tongue tie, please do not rush straight to a surgical procedure. Here is the recommended 3-step action plan. First, get a skilled feeding assessment. See a lactation consultant, an infant feeding specialist midwife, or a pediatric doctor trained in feeding dynamics. Have them observe a full feed from start to finish. Step 2. Optimize mechanics and body tension. Sometimes, tightness in a baby's neck or jaw from birth positioning can mimic tongue restriction. Simple positioning adjustments can often unlock the mobility you need. Step 3. Consider a surgical division only if functional restriction remains. If a trained professional confirms a functional tongue tie that is impairing feeding or weight gain, a simple surgical release can be performed. But remember, clipping the tissue is only half the battle. Post-release support and learning how to use the newly freed tongue muscle are essential for a long-term success. Remember also, an early feeding struggle is not a reflection of your ability as a parent. Feeding is a partnership, and finding the right support team to guide you through mechanics versus anatomy and the state of the tongue makes all the difference. If you found this video clarifying, please give it a like so YouTube can share it with other parents who might be struggling today. Don't forget to subscribe for more evidence-based child health guidance, and let me know your thoughts in the comment below. Thank you for watching. Keep stacking those little actions and see you in the next video.